Scanning the lower extremities can present ergonomic challenges as sonographers try to reach the ultrasound system and the patient at the same time. Lower extremity exams for DVT evaluation or for varicose veins involve scanning both above and below the knee. It is important to optimize your work postures for each part of the exam. When scanning above the knee for a DVT evaluation, position yourself so that your shoulder is adjacent to the patient's groin and externally rotate the patient's hip. Adjust the height of the exam table so that your scanning arm is not abducted. Bring the ultrasound system close to you so that you avoid reaching, and position the monitor directly in front of you. When a sonographer scans a patient's calf, she often scans with her arm behind her shoulder. This causes compression of the vessels around the sonographer's humeral head and can reduce blood flow to muscles and tendons. This position also results in overreaching with the non-scanning arm to access the control panel of the ultrasound system. Furthermore, the sonographer has to twist her body in order to reach the patient's calf to augment blood flow. Take the time to move to the end of the exam table so that your hip is level with the patient's ankle, and move the ultrasound system closer to you. This will allow you to scan the calf with minimal reach and arm abduction, and without working with your arm behind your shoulder. Another solution is to reposition the patient whenever possible so that he or she is sitting on the edge of the exam table and resting his or her foot on your thigh. If you are scanning both legs and the patient is mobile, have your patient sit up and turn around on the bed so that his or her head is at the foot end of the exam table. This will position the patient's left leg closer to you and eliminate the need for you to reach over the patient. Varicose vein exams require the sonographer to scan with the patient in a semi-upright position or standing. This often results in the sonographer sitting on the floor, which makes it necessary to reach up to the ultrasound system's keyboard and to hyperextend the neck to view the monitor. One solution would be to have the patient stand on a stool, preferably one with some type of railing. Then, lower your chair and position the ultrasound system so that you can achieve a more neutral posture with your arms and head. You can also use the same position as with DVT exams, with the patient sitting on the edge of the table and resting his or her foot on your thigh. Adjust your chair height and the table height so that your arms are in a more neutral position. Try to position the ultrasound system so that you avoid twisting your neck. Be aware of the position of your non-scanning hand as you compress the patient's calf during augmentations. Try to keep your wrist in a neutral position. Another alternative to augmenting venous return is to have the patient self-augment. You can ask the patient to flex his or her foot up and or to point the toes down, then relax. This will briefly augment venous flow in much the same way as manual compression of the calf, but you now avoid twisting and bending in order to reach the patient's calf with your non-scanning hand. In patients who are able to cooperate in the exam, self-augmentation should be used so that the sonographer can maintain a more neutral posture during the exam. The use of awkward scanning postures can therefore be reserved only for those patients who cannot perform this maneuver themselves, or in whom self-augmentation is not sufficient to demonstrate adequate venous return. Optimal patient positions may not always be possible, but you should strive to use them as much as you can in order to minimize your risk for injury